One of the issues that we're trying to solve all the time at St. Luke's is how do we solve for provider burnout? How do we solve for reducing pajama time? How do we solve for increasing EMR satisfaction among our physicians?
And it's all about, at the end of the day, how do we improve that human experience? Before the visit, during the visit, after the visit, that's what drives us. That's the mission of St. Luke's. How do we improve the health of people in the communities we serve?
Since we had the electronic health record come into our exam room with the patient, it became a barrier to patient care because my attention was focused not only on the patient care needs, but on the computer. In a typical day, I will see anywhere between 20 and 30 patients. If it's a busy flu season, that might bump into the 35 patients a day.
I would say for every 4 days of patient care, I would spend a full day of documentation. So that usually works out to be 2 or even 3 hours of documentation at the end of every day.
And so we have always been looking for ways that we can innovate and deploy technology that can make those tasks easier.
This is a program that effectively listens to a conversation, pulls out medically relevant and personally relevant information, makes it readily available. We can spend time doing what we want to do, which is teaching our patients about things that they can do to improve their life, or spending time, preparing for the other part of our practice, which is in the operating room. Because it's so well integrated with Epic, patients can go back and review the note and hear exactly what our conversation was, so that they can refer to it later, and I find that very beneficial.
I don't have to type while the patient's talking. Instead, I get to push away from the computer, look at the patient, and listen, or educate, or problem solve together. I feel like my patients have appreciated that. They know that they have my undivided attention.
Before, if there was something really salient that I wanted, either homework for the patient to do or for them to look up some additional resources, I would have to type that in as we're talking. And now I just talk about it, and it's able to correctly identify, like, hey, this is something I want them to do, and it puts it in the patient instructions. And all I have to do is click a button, and it includes that for that patient before they leave.
I've noticed that if, for example, my kids have an activity that starts in the early evening, even if I may have had a long clinic day, I can finish my clinic day and immediately leave the clinic, knowing that the work is mostly finished already.
I think patients who have the experience with a physician or APP feel seen and heard in ways that they haven't maybe ever in their lifetime of receiving medical care.